Thank you, Mr. Speaker. I'd be happy to yield to questions.
All right. Chair recognizes Representative Bruce for the purpose of asking a question.
Will the gentleman yield?
Certainly.
So if these children become pregnant because they could not get the contraceptives that they are requesting here, who's going to take care of those babies?
I thank the gentleman for the question. I think that is a real it's an issue for the day. It's something that we are having to deal with every day, and I have 4 daughters myself, and you know, I see those commercials you have on television lately where it says talk to your children about drugs, you know, the anti-drug, talk to your kids. And hopefully this is an opportunity for the folks here up in the gallery and the folks back home to understand that you need to talk to your kids about sex as well. You need to make sure that you're the one as a parent who is guiding them and shepherding them and trying to lead them to lead a productive life. And most importantly, the question then becomes, and I realize that this could be just a divide that some of us can't agree on, and I respect that, but for me it's a public policy matter. Shall the state give money or appropriate money that allows for birth control pills to be bought for children without their mamas and daddies knowing about it?
Well, the gentleman further yield.
Sure.
The question was related to those children that don't have someone to go to like you just described. There are many children out there who have no one to go to.
Yes, sir. I still believe that every child has to have a guardian, and so they need to go to that person, and that's I would respectfully say that that's who they need to go to.
Chair recognizes Representative Buckner to ask a question.
Does the gentleman yield?
Oh, certainly.
Is the gentleman aware that the DHR board chairman, Bruce Cook, changed the rules that are related to teen health clinics a couple of years ago, and that people who attend the clinics that are known as teen health clinics have to have parental consent, do receive abstinence training, and cannot receive contraceptives without parental consent, and are not referred to any abortion clinics?
I would disagree with that. However, that's a wonderful thing, because if that's true, then I guess you have no problem with the amendment. What would be the problem with having this in the budget? Then,
it's already being done.
Well, then what's the problem? Let's throw this in there. Nobody should be afraid. It's interesting. You'll see the opposition, and it's interesting when you see how strong the opposition gets on this. You'll see that in fact it is still being done. Otherwise, why would there be this strong protest?
Chair recognizes Representative Graves to ask a question.
Gentlemen, yield yield for a question. I'm sorry. I know they want you to yield.
I don't know about that.
Now, you had some great comments before, but I need clarity. Are you suggesting that the state is transferring or using taxpayers' money to offer reproductive counseling or contraceptives to our 12, our 13, and our 14-year-olds?
Yes, in fact, if you look on this this sheet that Representative Setzler was so kind to hand out for you, this sheet right here will tell the gentleman that, in fact, of the 24,000 in 2004 that went into the various teen clinics around the state, the overwhelming majority, 17,547, were given birth control devices of various kinds. Most of those are not even disease-preventing birth controls, and I think you can see that from there.
And you're also saying that can be done without a parent's or guardian's knowledge?
That's correct.
Well, I applaud your efforts on this, and I look forward to supporting your amendment.
Thank you, gentlemen.
Chair recognizes Representative Franklin to ask a question.
One further question. Is it not true that minors in our government schools have to have parental consent to get an aspirin in the school clinic?
I believe that is correct, but they do not have to have parental consent to go across the street to the teen clinic to get an IUD implanted in them.
Chair recognizes Representative Setzler to ask a question.
Thank you, Mr. Speaker. And again, to the gentleman in the well, do you yield?
Yes.
And again, I'm not trying to make this issue too complicated. I just have some concerns as information was made available to me. I mean, at the true nature of the issue. In 2004, oral contraceptives and 3-month hormone injections given to females under the age of 18 totaled 13,321.
That is correct. That is correct.
13, and again, this is the year 2004, the last year for which we have data.
That's correct.
So in 2004, 13,321 oral and hormone injection birth control doses were given to young ladies under the age of 18. And again, if this information that DHR has provided is true, there was 11 implanted intrauterine devices, which are surgically implanted devices inside the uterus of a young woman to prevent pregnancy. Does the gentleman does the gentleman know if this information is credible information?
It is credible information. It's taken from the Department of Human Resources. That's correct.
Does the gentleman further yield?
I certainly do.
Yeah, I'm concerned. This General Assembly acted some years ago to remove state funds for these purposes. That we would, isn't it true that it would make sense, we would at least consider and search our consciences whether we should allow us to appropriate and pass through federal funds to do the same thing. Is that a concern of yours in bringing this amendment?
If you're opposed to state, I would agree. If you're opposed to state funds being used for this purpose, then it seems as though you'd be opposed to federal funds being used for this purpose as well. And I would certainly agree.
Now, is it true under the Title X provisions that allow these funds to be dispersed that there's some limitations in terms of states being able to require parental consent?
They do not allow you to have parental consent, and that's part of the process. There is disputed information.
For these Title X funds that are in question?
That's correct. Only for these. And we're only
just these Title X funds?
That's correct. We're talking about $4.6 million in the budget, 27.2 in your budget.
Does the gentleman further yield?
The chair would remind the gentleman in the well that more than half your time's gone, so you may want a lot of questions here. So, Representative Setzler, if you would, be mindful.
Representative Setzler, I'll take one more question, then I'm going to yield.
From you.
Is it true that or isn't it true rather the age of consent in Georgia is 16 years of age, and that in fact provisions of the teen clinics allow birth control devices to be dispersed to young ladies as young as 12 years of age?
That's correct, Representative Setzler. It is against the law for these children to have sex, and here the state hands out contraceptives to these children without parental knowledge or consent. That is the key issue here. We're not even debating the issue of whether or not the state should be funding this program or the federal government should be funding this program. We're debating whether or not parents should have the right to know what their children are being given by their government. Thank you, Mr. Speaker. I'll yield the well.